He's a South African, and Dudula's chasing him away. What rights does Dudula have to demand people get IDs?
Because these are people that they consider as foreigners. They are not really recognized as humans in this country.
How old were you when you came?
I was 10 years old.
10 years old, eh? So you've pretty much grown up in South Africa.
Yeah.
You're listening to The Ordinary Activist with Nigel Branken on Hillbrow Radio, because activism starts with ordinary people.
Great. Welcome. And today's show, we're going to dig deep into health-based xenophobia and clinic access in Gauteng, where even basic care is being denied because of nationality and stigma. So stay with us. We've got an exciting show ahead. Hillbrow has always been a place where foreign nationals have come in. This has always been a place where people have come to seek a better life. Right from the early discovery of gold in 1886, the first discovery of gold, when they shouted out in that October, I think it was the 3rd October in 1886, they shouted, "Gold!" And you can just imagine all around the world, people just started to say, "Egoli, here we come." And they came from Joburg. They came to Joburg from Mozambique, from Malawi, from Zambia, from Zimbabwe. And Hugh Masekela's Stimela tells that story so beautifully. So up next, what I'd like to do is to also just introduce you to our social worker who is in the studio with us today. Mildred, do you want to just tell us a little about, maybe just introduce yourself? It's great to have you with us today.
Hi everyone, my name is Mildred Miller and I am a Portuguese student social worker at the University of the Witwatersrand.
Oh, that's wonderful. And I believe you've got a really great supervisor.
Do I?
I'm trying to get it on air so it's on record that I supervise her in a good way. I hope I do. But Mildred, you've been working with the migrants for about 6 months now.
Yeah, for about 6 months.
And I'm sure you've got lots of stories also to tell. But what I'd like to do now is I would like to have this new slot that I bring into this show, which I'm going to be calling Activist Voices. And so what I did this morning was I went out to some of the organizations working with migrants, and I asked them for their perspectives on what was happening with Operation Dudula. So I'd like to first just bring in a voice note that we had recorded from Annie Michaels. So let's have a listen to what Annie Michaels had to say.
Good morning. Annie Michaels here. My thoughts on the vigilante group Dudula, actions I've been following for a while now, is question that I'd like to ask is, why is it that our government is giving them free rein on doing whatever they want to? It's actually a grave concern, not just to me, but to the wider community, and a stressful situation for most of the migrants regarding access to health issues. Or on the other side, I can also ask, is there someone behind this group who is pushing the agenda that some of us is not aware of? Operation Dudula should be called to order. That's my other thoughts on it. Operation Dudula should be called to order by law enforcement. All leaders should be set down and be educated on the human rights laws that cover migrants, not just in South Africa, but everywhere in the world. That it is important that we are all humans, no matter what color or what country or language you speak. So these are actually my thoughts on it, my personal thoughts on it.
Hi, this is Dr. Dale McKinley. I am a coordinating committee member of Copenhagen Africa Against Xenophobia and a longtime political and social activist with workers and communities. What is going on with relation to Operation Dudula and other such organizations in illegally and criminally carrying out activities to prevent foreign nationals, particularly those from the rest of Africa, from accessing healthcare facilities, and other educational facilities as well, but mostly healthcare in the past, is completely unacceptable and outrageous. It is not only against our laws, but it is inhumane. It is a sad reflection of a politics which is seeking to blame the most vulnerable and the most marginalized for problems that are not theirs. The crisis in our healthcare system is real. We understand this, and we understand that there is a lot of frustration, but that crisis is on the basis of mismanagement and corruption and years of neglect and other things, as opposed to the system being overwhelmed by foreign nationals. We also understand that there are problems with our immigration system, but those need to be fixed at source, not to blame the individuals. Our government needs to enforce the law. Our police services and others need to make sure that Operation Adula and others are not able to carry out what they're doing. This is against the law. It is illegal. They must either be taken out of the areas where they are operating, or they must be arrested, and the law must be enforced. We also must see the politicians and our ruling parties and our governments come out very strongly against this, both verbally as well as in action, to begin to support and put in place the proper mechanisms to fix our healthcare system and to fix our immigration system, and to make sure that we are a country that values its constitutional principles of Ubuntu, of inclusivity, of tolerance, not of hatred, not of division, and certainly not for African brothers and sisters.
Have you got a story? Because you've got a voice. Send your voice note to 074 555 7774. Be heard, be bold, be an ordinary activist. That's 074 555 7774.
Thank you, Dale McKinley. I think he's come out and said it quite strongly. I agree with Dale. I don't know what you think, Mildred. A couple of points that he made there. I think the strong one for me was we need to name the problem for what it is. It's not about migrants. It's about, we've got a couple of issues. We've got a documentation crisis. People are not getting documented. I don't know, Jethro, how many times you've tried to get documented. I know you've also tried to get documented. I do a lot of work with refugees. Just this weekend, I was working with a Ugandan refugee who is LGBTQI and was facing the death penalty in Uganda. Came to South Africa and has gone to the RRO Centre, that's the Refugee Reception Referral Office in Pretoria, called the Desmond Tutu Centre. He's gone there twice already, and both times he's been turned away. Now, that's unlawful. International law requires that we give refugee status to people who've got a legitimate refugee claim, and there's a clear blocking of people trying to seek refugee status. Mildred, I know that you do a lot of work with documentation. What is your kind of experience around documentation?
Yeah, firstly, I think I agree with you, and I agree with what the person on the voice note was saying. I think my colleagues and I actually had a conversation about this a few days ago. I think it's more about scapegoating. It's like whenever there is something going wrong in South Africa, it's hard for like the South African government to actually take ownership and admit or agree that they are actually wrong. It's usually about scapegoating. So I believe that because these are people that they consider as foreigners, it's much easier for them to blame everything on them because they are vulnerable at the end of the day. There isn't really much that they can do considering that they don't have documents and they are not really recognized as humans in this country, if I can put it that way. So I think more than anything, it's about scapegoating and shifting the blame to other people.
I think that's very true, the scapegoating point that you're making. We certainly, Sharon, it's a pity we couldn't play her voice note, but her and I went to lay the complaint against Dr. Popilon Matuba. You'll remember in August, I think it was 2023, she was the one who went and berated that Zimbabwean patient at the clinic, at the hospital, in the hospital bed, and she said, "You are to blame for the lack of delivery in healthcare services." And of course we know that 5 weeks before she went and made that statement, the SIU had recommended prosecutions for people in the department for the 130 odd million PPE fraud that had happened. And then 2 weeks before, of course, we had the Hawks radio officers. I believe they took her cell phone and her laptop just 2 weeks before. And then just 5 days before she goes and makes the video, the Auditor General's report comes out for Limpopo province. And what we heard was 51% vacancies in the department. These are budgeted for vacancies. She had underspending on her budget of 120 million rand, underspending on her budget. Billions and billions of irregular expenditure, billions and billions of wasteful expenditure that had gone on for several years. The Auditor General's report talks about poor consequence management when there's tender fraud that's happening. Then there's no follow-up on that. And I spoke to a director of a healthcare facility and said it's intentional. You don't staff these facilities so that you can say that we don't have the capacity to track what is happening properly. And that's how people are getting away with fraud. I looked at the Auditor General's report for Gauteng province. 5.4 billion rand this year in irregular expenditure for Gauteng. And of course, who are we going to blame? Foreign nationals. Why? It becomes easy. Exactly what you're saying, scapegoating. And that's what Dale was saying as well, the scapegoating and the corruption.
Yeah, and going back to the Operation Putula also, from what I know, they said it's about people who are undocumented and are in South Africa illegally. But actually, when these people went to the hospitals and clinics that they went to, they were turned away. No one necessarily asked about their documents. No one actually dived deep to actually find out, is this person documented or not? And if not, why is that so? It was more so about, you are not a South African, therefore you are not allowed here. Whether or not you have the documentations, they don't really care about that. That's just something they put at the forefront. Like, okay, this is about putting the country into order, whereby they say it's about people not being documented, but it's actually beyond that. It's just about xenophobia, point blank. I think that's what it is about. Whether or not you have documents, you're still going to go through the same process at the end of the day.
And the truth is, we spoke to Stats SA in terms of the provincial equitable share. Foreign nationals are budgeted for in our healthcare system. They're budgeted for. The reason we have declining healthcare is pretty much got to do with corruption. And of course, we do also have austerity coming in as well. But when we still have underspending and we still have these levels of corruption, we can't say that it's just because of austerity or because of foreign nationals. I wanted to also just pick up on your point. I don't know if you saw the video of Crispin Himson in Addington Hospital, Durban. So this is a anti-apartheid activist. I understand he's in his 70s. And he went to Addington Hospital.
Oh yeah, I do remember that video.
Yeah, he went to Addington Hospital to go and get healthcare, and the next thing, Dudula's asking him for his ID. So he's a South African, and Dudula's chasing him away because he refused to show Dudula his ID. What right does Dudula have to demand people get IDs? Jethro, can I come to you? Maybe you can just tell a little bit about what happened with Triumph. So I know that Triumph is your son. The microphone is on your left-hand side. There we go. We're just helping Jethro to get his microphone in place. Great. So tell us a little bit about what happened to Triumph, Jethro. You can talk.
Okay. On the 16th of July, my daughter, Triumph, a 13-year-old girl, fell sick. Then we took her to Jethro Clinic. Then when we got there, we got the same treatment as I got on the 9th. They refused us entry into the clinic. Then we take the child back home. Then we tried Hillbrow Clinic on the same date in the afternoon. Then they did the same. They also refused. They didn't treat her.
So Jethro, just coming back to that, I remember when Triumph was born. Where was Triumph born? Charlotte Maxeke Hospital, wasn't it?
Yes, Triumph was born in 2012 in Johannesburg Hospital.
Johannesburg, South Africa. So Triumph is South African, but doesn't currently have documentation because her parents were, in fact, her mom passed away sadly, totally. And I mean, part of the reason that Triumph is called Triumph. I don't know if you want to tell that story. It's quite a profound story that I remember because Tantigwe lost a baby at Charlotte Mfeke before Triumph, and then Triumph was born. Do you want to tell us the story?
Well, the story is a bit complicated, but in short, we just thought it was a victory to have another baby after the one that before had passed away. And Triumph was born with many complications. She is Down syndrome. That's one thing. And when she was born, it was discovered that she had 2 holes on her heart, which holes had been closed after 2 years. In 2014, she got to hospital to get an operation. Was operated on, and they say they closed the holes. Before that, the operation, noticeably she was not growing. But then after the operation, she started growing very normally. Yes.
So Triumph was born with cerebral palsy, I believe. Sure, it's quite a journey, and I think the more you hear stories of marginalised people, the more you realise we've got an obligation to care for that. I remember in the Freedom Charter it says that South Africa belongs to all who live in it, and we want to create a South Africa that where everybody feels welcome, where everybody feels safe. I don't know, Mildred, any last closing thoughts? We're coming to the end of the show now.
I just think we need to end the stereotype, and I believe that it starts with us. I will use the Operation Villa again as an example. I just came to realize actually that it is actually a very small organization. It is like way small. It's smaller than Lawyers for Human Rights, but it actually has such a huge impact. I think it's up to us to actually realize and try to understand why is it that it has such a huge impact, but it's so small. I think it stems from biases and the stereotypes that we've lived through all these years. I mean, we were born here, some of us, and we grew up here, and it's just things that we were told. As soon as you see someone who's not South African, you are told that, oh, this person is actually here to steal our jobs. This person is here to sell drugs and all those things. So I think it's important for us as South Africans to actually educate ourselves and understand that people don't just leave their countries to come to South Africa because they just want to. Some people, these people that we consider as illiterate and everything, some of them are actually way more educated than we are. They're actually way more knowledgeable than we are, but we only see the surface level of things. So I think we need to understand that these people have real reasons why they've left their countries. It's not only because they want to steal anyone's job or because South Africa is better than their countries. There's a lot more reasons to it, and there's just a lot more reasons that we can't discuss right now, but I think it's important for us to educate ourselves overall.
Mildred, can I just ask you if you could tell us, what do you think our listeners should be doing as they consider what actions they can take? What do you think listeners could be doing? So I personally, I think our listeners need to be organising. Yeah, what do you think listeners need to be doing? For South African, let's talk first of all South African listeners.
Yeah, I think we need to start there, educate ourselves, educate yourself as a listener, as you're listening to the stories that these people are actually telling to us. Actually be considerate as an individual, but I believe that more than anything, we just need to educate ourselves and think outside of the box and be open-minded. Yeah. At the end of the day, we are one. I mean, we can't just say that on paper and actually act differently. So if we're gonna say we are one, it should also reflect in our actions. So more than anything, I think we should educate ourselves and be more considerate.
And what would you say to Zimbabwean residents? What do they need to be doing? Or foreign nationals who've been denied healthcare?
Honestly, I think there's a lot that we could say they need to be doing, but it's not easy for them, and that's not something we can just ignore. We can say that they need to be more vocal and speak about their rights and also educate themselves about their own rights, because I've realized that they don't actually know that they have rights here in South Africa because of everything that is going on. They actually don't know that they do have a voice and they have rights. So I think they also need to familiarize themselves with that more than anything. But more than everything, overall, I think we South Africans need to be the advocates. Because if we are not advocating for them, it doesn't matter what they do. At the end of the day, they are still in South Africa. They are not originally from here.
Yeah.
And if we are not on their side, there is really very little that they can do.
So I wanted to, just for my side, just say to listeners, if you could all take this as a personal cause this week, make a phone call to your local police station, Hillbrow Police Station, Yeovil Police Station, Jeppe Police Station, Joburg Central's, phone the station commander, speak to them, say, look, you need to intervene. What Dudula is doing is unlawful. There's court orders in place. You need to be protecting them. If you know foreign nationals who need to go and get health care in clinics, go with them to the healthcare clinics. Let's go in solidarity. Let's be the ones who actually go there in peace and make love happen in our communities. We're a society that has come from a horrific background where we fought the fascism of apartheid. Let's not allow the fascism of Operation Dudula to rise up and tackle us. So just before we go, I want to just talk about next week's show. Next week's show from 1 to 2 is going to be an incredible show. We'll have in the studio with us, it'll be focused on Palestine and Palestine solidarity. And what we're going to be doing is we'll be getting into studio Roshan Dadu from BDS. And she'll be talking about what actions we practically as local South Africans can take. We'll also have an international guest with us who leads a water-based NGO, Abir Al-Budma. She's the coordinator of the Palestine Environmental NGO Network. And she'll explain how water apartheid works and how we can stand in solidarity with Palestine in terms of water. And then I'm also hoping to get in, I'm reaching out this week to some of the cola companies to talk about the boycotts that are happening with regard to Coca-Cola, because we want to make sure that in spaza shops in Hillbrow, Yeovil, all over here, that people have an alternative to Coca-Cola so that we can stand in solidarity with our purchasing power. We want to actually buy in Kingsley. I remember I went to a braai with some friends, and when I took out the Kingsley bottle, my friend said to me in Zulu, he said, that is the drink of a poor man. Actually, it's the drink of a person who stands in solidarity with the oppressed, who stands in solidarity with Palestine. So that's it for our show today. Stay tuned. Come back in. We'll pick it up after the show with another show. Thank you for being on Ordinary Activist Radio. Thank you for listening. We've heard the pain, the courage, the truth. Thank you to our studio guests. Whether you're in Hillbrow, Jeppe, or Yeovil, or anywhere across South Africa, remember, your voice matters. Keep sending in your stories about your activism this week to 074 555 774. 074 555 774. That's our WhatsApp line. Ordinary people are bringing change. Stay strong, stay proud, stay loud, and let's be active, ordinary activists.